Breaking developments coming in after the attack on Saif Ali Khan. His mother Sharmila Tagore has travelled from Vasant Vihar in Delhi to Mumbai to check on her son's condition. Sources also revealed that the guard at her residence learned about the incident through news on television and told her. Let me also quickly bring in at this point Dr. Ritesh Agarwal, laparoscopic surgeon, who's joining us live. Dr. Agarwal, obviously a very concerned mother, Sharmila Tagore, rushing from Delhi to Mumbai to be with her son at this point as he, of course, recovers from this horrific attack on him. Dr. Agarwal, right now, what do you make prima facie of the recovery process now? The surgery has already been conducted this morning, emergency surgery on Saif Ali Khan after he was rushed to Leelavati last night.
Yeah, actually, like whatever information I am getting, I am also getting through newspapers and news channels. So what we came to know, like there was a 3-inch piece inserted into spinal cord and dura was ruptured. Definitely there will be some kind of neurological injury or trauma to him, and that needs to be assessed properly. Definitely is out of danger because there was no major vascular injury. But definitely because the piece was inserted in the spinal cord, nerves will be affected. So once he is totally like conscious after the surgery, we have to assess what's the condition and what's the neurological damage he have faced. So that will need some time to assess properly, and he'll be needing multiple MRI scans and neurological assessments and proper neurologist to know the extent of injury.
Yes, Dr. PSV Rao, consultant surgeon, Manipal Hospital, Hebbal, Bengaluru, also joins us now live. Dr. Rao, the hospital has given a statement saying that he is out of danger. Now, what does this medically mean? And what is the road ahead now for Saif Ali Khan's recovery after multiple stab wounds, were inflicted on him in this attack in Mumbai?
Good afternoon. I have been busy all day, so I have not really been following the news. But as to your question of multiple stab injuries, it all depends on which part of the body these stab injuries are, how deep they are, and if many of them are just skin deep or into the muscle and they are not gone into the vital organs, then it is none of them may be of
some of them we're told were a bit deep. A couple of them are close to the neck, also on the back. Obviously there was some spinal leakage as well, we are told. There was also a small piece of a knife as well which had got stuck close to the spinal cord. That has been surgically removed as well, Dr. Rao.
Yes, okay. See, the neck is a very extremely sensitive area because you have got two blood vessels going to the brain. There are two major blood vessels going to the brain, the carotids, and then you have got the two jugulars which are draining the blood from the brain and the head. In addition to it, you have the airway, the trachea, you have the various other important structures there. And if you said that there was in the spine also, then it can have neurological deficits. If the injury to the spine occurs at the neck, you can have complete weakness of the lower part of the body, depending on how much injury occurs to the spinal cord. And if it is lower down, the lower it is the injury to the spine, the lower the chances of loss of sensation or loss of motor power, of ability to use. Now, if a piece of knife was left inside, then I would think there are two possibilities. One, it was the knife was thin enough to break when it got stuck between the vertebral bones. The other possibility is if it was a reusable blade, like what we use in surgery, a surgical blade can come apart from the handle. But if it is a piece, then probably it got stuck in the bone or stuck between the bones, and that's how it broke when in the struggle. And if it has gone into the spinal cord, caused a dura cut, and you're saying a spinal fluid leak, obviously it has gone into it does injure the spinal cord. Now your part of the question which you said out of danger means vital organs are safe, there is no risk, danger of loss of life. or that is what we mean by not in danger, especially if the vital organs, that is the heart, the lungs, all these are safe. So if you have a chest injury and air leaks in, your lungs can collapse, and then you may not be able to breathe. And in the neck injury, if the breathing tube has been cut, or a major blood vessel has been cut, then there is definitely risk to life. So they must have explored all these wounds in the theater. As a surgeon, that's what in my years of experience of dealing with injuries of this nature, we will first explore all the wounds to see which wound is the dangerous wound, and we will first give emphasis to that before we start looking at the other wounds. And nowadays there are these various ways of investigating also, including the ultrasound, which we can use in the theater. And there are theaters which are have got the not only the X-ray machine, there are theaters even with the CT scan machine inside the. So these facilities are available, not in every operation theater, but in some of the major theaters. So these facilities can be used. Ultrasound now is virtually available in all major theaters. It will be there with the anesthetist, and we can use it to see what are the soft tissue injuries, and especially when you're talking about the neck.
Right. Okay. Okay, we're going to closely track this story. For the time being, my thanks to all of our guests for joining us on this discussion. Of course, we are sending out our speedy recovery wishes to Saif Ali Khan. Thankfully, he is out of danger, but now, of course, the investigation is very, very crucial. We'll keep tracking this story for the time being. Let's slip into a short break.